And you mentioned that when people hit puberty, they find that that's when the HS surfaces. And I'm wondering that you mentioned this is also having some hormonal components. What hormones are involved? Because in my mind, I'm thinking about like hormonal acne. That women tend to have monthly. So is there
Yeah.
any relation between that? How do hormones
There
play?
is. There is a relation between that, and it's thought to be the same hormones. So, androgenic or hormones, or like testosterone, androgenic hormones are involved, and also the fluctuations in the hormone levels. So that's why patients, at certain points, puberty, onset of the menstrual cycle, usually a week before the menstrual cycle, that's when you start to get those hormonal fluctuations. And also during pregnancy, that's when we tend to see that patients are getting more flares around this period.
So what's the typical treatment regimen for a person with HS, and are there different classifications for a severity of the disease?
Yeah, so the earliest classification or staging system is called the Hurley staging system. And this is divided into three stages: stage one, which is mild disease, stage two, and stage three. Now, the issue with this classification is that it's very simple. It's overly simplified, and so patients with stage one have nodules and abscesses, no scarring or tunnels. Patients with stage two have nodules and abscesses with some scarring and maybe one or two widely spaced tunnels. And then patients with stage three disease have multiple interconnected tunnels and scarring. The problem with this staging system is that it's static, so it's not dynamic. It really doesn't tell us the activity of the disease, but it's helpful when we're trying to decide what treatment to start patients on. A more recent scoring system is the IHS-4, the International Hidradenitis Suppurativa Severity Scoring System, that then allows for counting of lesions, and that tells us how severe the HS is. So if a patient has nodules, you multiply the number of nodules times 1. If the patient has abscesses, you multiply that by 2, and if the patient has draining tunnels, you multiply that by 4. So if the patient has a total score of 3 or less, that's mild disease. Total score of 4 to 10 is moderate disease, and greater than 11 is severe disease. Now, the reason why I'm laying this foundation is because this tells us how to treat HS. So treatment is based on if it's mild, moderate, or severe. So for mild HS, we typically focus more on topical treatments, so topical antibiotics, topical agents like resorcinol. And then sometimes for flares, we would give antibiotics, systemic antibiotics. And then for moderate disease, we start to think of more like immunomodulators, like biologics, in addition to all the other treatments for mild disease. And then we also start looking at surgical options, so deroofing and wide local excision. And then for severe disease, we're looking at IV antibiotics, more extensive surgery, and even sometimes combining immunomodulators.